And today, by the way, this is Ed Weir, former manager of the Social Security Administration. And today, this is a little bit unusual. We're just going to do question and answers today. So if you're watching this live, go ahead and put your questions about all things Social Security, retirement, disability, Medicare, Medicaid, survivor benefits, spouse benefits in the chat. And I will get to as many today as possible. Usually with these, I've been doing these on a daily basis. But I usually do a topic for the first 5, 10, 15 minutes, something about survivors or disability or Medicare or Medicaid or something like that. And then I do a question and answer for about an hour or so. But today, I've had so many questions recently, I figured I'd just go ahead and jump right into questions and answers. So if you don't have any questions today, make sure you subscribe and like and all that kind of good stuff. And that way you can find us in the future if you ever do have any questions. All right, so go ahead and jump in there, ask any questions you have. I've had a lot of questions on my YouTube channel. So while we're waiting for people to jump in and ask questions, I think I will go ahead and answer some of the ones I've received on YouTube. And I did a video on why I wouldn't take Social Security at 65, and it's all relative. It really depends on your particular situation, but a lot of people chimed in and they say 62 years old or 70 or 65. So in terms of when you take your Social Security benefits, when you start, 100% a completely personal decision based on a whole bunch of different factors. Yeah, and I did a video the last couple of days that's gotten some good views, which is awesome, because there's a lot of people out there that are not getting the benefits they're entitled to. A lot of people. So make sure you check out that video. The title is, I do so many of these. It's about getting all the benefits you're entitled to, what you're missing. I did one on how to increase your Social Security benefits, how to increase your check. And so there's a lot of people out there, didn't know that you could file for retirement and disability at the same time, given incorrect information by the Social Security Administration that they're not entitled to spouse benefits when they just happen not to be entitled that particular day. A lot of those, unfortunately. Social Security needs to do a lot better job on notifying people that, okay, you're not entitled today because of that person is living and you can only get up to 50%. But if that person continues to work, or if that person passes away, then all bets are off, and now you can in fact collect benefits. So yeah, so I've been doing a lot of videos on that. So actually, let me go ahead and well, let's see. I'm also on TikTok here. Let me check. Social Security will run out. When do we think that point will be? Yeah, so that's see a lot of people making decisions based on this kind of, I guess for lack of a better word, kind of a macroeconomic, future projections of, the Social Security Trust Fund comes out every year and gives, its projections. It's actually increased some of them this year, Social Security and Medicare a few years out. But yeah, I really shouldn't. I really don't think you should make a personal decision of when you start receiving your Social Security benefits based on something like that. Future projections. They even said even if it's the trust fund, because the trust fund every now and then, our trust fund started in the 1980s. That's when they really started focusing on that, because you have obviously the baby boomers, 1946 to 1964, 76 million Americans. And in the 1980s, they said, these people are going to start getting old. And if they're lucky, the alternative of getting old is far, far worse. Not as bad as male pattern baldness, but anyway. But yes, these people are going to start getting old. They're going to start collecting their Social Security benefits. So maybe we should put some money away in the trust fund. And that's what they did. They put the money in the trust fund for the baby boomers. And now the baby boomers are using that money. So of course the trust fund is going down. But one of the problems is they didn't project the reduced number of births because the current people pay into the system and they support the people that are currently receiving from the system, and they just did a incorrect demographic analysis, and thus they need to do something more. Since 1935, Social Security Administration, and since 1965, Medicare has changed the system on a regular basis. Now it's just another time to change the system. But politicians aren't going to change the system until we jump up there and make them do so. And I did a video on that a few weeks ago, so make sure you check out that video. All right, let me see here. Let me go ahead and jump in here. We've got some questions. Let me go ahead and get this all changed over so you can see the questions that are coming up here. Ramesh Sharma, I am going to be 62 years old in October. If I claim Social Security then after, may I work? Absolutely, absolutely. So once you start your early retirement, you can continue to work. That's what a lot of people miss, is they say, well, because the Social Security used, and I use retirement. Okay, when do you want to retire? When do you want to start receiving your retirement benefits? And people think that, well, I'm not going to retire. I'm still going to work. No, I know. But in terms of Social Security, what the Social Security employees, again, I ran the third busiest office in the country. I worked for Social Security Administration for a few decades. And so we always say, okay, when do you want to start your retirement benefits? And I'm not going to retire. Yes. But in terms of Social Security, that is retire. You can still work. It's just that you have to limit your work. So if you were working Ramesh, if you were working a job that was making $100,000 a year, then you definitely should not start receiving your Social Security benefits at 62, because Social Security is going to offset that $1 for every $2 you go over the annual earnings limit. This year it's the $22,320. It changes every year. So if you go over $22,320, Social Security will hold back $1 for every $2 you go over. So if you're making, considerably over that, then it's not a good idea to go ahead and start your Social Security benefits, retire. However, if you're going to start working part-time and you're under that, then yeah, you can start your benefits in October. But you have to be 62 the entire month. So if you were born on October 1st, you can start in October. But any other day, you will have to start your benefits in November. And Social Security always pays a month behind. So your November check will come in December. So it always pays a month behind. And then there's the annual. If you go over the year, if you make $1 million up until November, you can still file for retirement benefits. You can still start your benefits. The first month, you go under the monthly limit, which is the $1,860, $1,860. It's basically $22,320 divided by 12. So the first month you're under $1,860 a month, you can start your benefits, and there's nothing withheld. And then next year you have to stay under the total annual. You can only do the monthly earnings limit thing the first year, basically. And with everything else, there's exceptions on everything. There's over 20,000 pages of Social Security policy, and so it's the whole thing is let's say interesting. And that's why I'm on here all the time answering all these questions, because there's so many exceptions to the exceptions to the exceptions. So let me see. Barbara called Social Security today for a readout of my benefits, and the guy said he could only tell me the number for today. Do I have to go to the Social Security office to get this? Okay, read out of your benefits. So you're currently receiving Social Security benefits, and you just want a benefit. We used to call it a benefit verification letter. Then yeah, I mean, it's they can tell you what you're receiving, this month, or it also depends if you're receiving SSI. That changes on a regular basis. So, but are you asking for a projection of your benefits in the future for future retirement, 62, 63, or 64. Those are two different printouts. So yeah, let me know, and I'll do a better job of answering your question there. Ellen, why did my husband not get any benefit working past 70? No increase in Social Security received. Yeah, once you hit 70, that's it. You're maxed in terms of your delayed retirement credits. You get delayed retirement credits for every month, every year you wait after your full retirement age, and that ends at 70. So yeah, so it's 8% per year up until you're 70, and after that, there's no increase. Again, exceptions. You do get a COLA increase, so he should have got his COLA increase like everybody else in the country. And if your husband worked, I've got a video on this, and paid into Social Security, and that year is one of the high 35 years of earnings, then Social Security automatically recalculates and gives him, anybody, the extra benefit based on paying more into Social Security. Okay. All right. Here's Barbara. I'm going to jump to Barbara right here. She's got a follow up. I have widow's benefits now and want to hold out for best number when I retire. Oh, okay. Okay. Good. You did. It sounds like you did everything correctly. I've done a few videos on this. So many people miss this one. Good on you, Barbara, sounds like you did it right. So it sounds like Barbara was smart and she took widow's benefits, widower, surviving spouse. It's all the exact same thing. And you can start that at 60 years old. And she started her widow's benefits and she didn't touch her own benefits on her own record. Okay. So she's taking her widow's benefits and she's collecting that, and she's just letting her benefits on her own record increase until, 65, 66, 67, all the way up to 70 years old. And then when it gets to a good number she likes, she'll switch from widow's benefits and jump over to benefits on her own record. But it sounds as though she called Social Security and wanted to find out how much benefits are on her own record, and they only gave her, yeah, what it is. Yeah, you can get a benefit matrix. They print off a little benefit matrix. Yeah, if you could, it depends who you talk to. If they're good employees, all my employees were good. I had about 100 employees, and they were awesome. One or two that was iffy, but we got rid of them. But you can call the 800 number or your local Social Security office and ask them for a benefit matrix, and it'll tell you how much your benefits will be, next year, 2 years from now, 3 years from now. Again, these are projections, estimates. So these are estimates. Yeah, rather than going down the office, if the employee is good, then you say, hey, can you go ahead and print that off for me and mail it to me? And if it's a good person, good customer service, then they'll just throw it in the mail. But if not, then yeah, you'll have to go down to the Social Security office and ask them for a benefit matrix based on your work record. So that sounds like what you're looking for. So, all right, let's see what else we've got here. Pappy B, hi doc, got a question. I'm about to receive my first Social Security check after reaching full retirement age. Okay. I don't read these questions. I don't. Nobody screens these questions. You got a bunch of other YouTubers out there doing Medicare and Social Security and stuff. They screen the questions based on ones they can actually answer and they actually know because they don't have experience. And but I don't do that. I just pop it up on the board. You read it the same time I do. So hopefully we won't get in trouble here. You all be nice. Zippy, I started collecting. Yeah. So the previous one, Poppy. Yeah. Go ahead and ask your question there. I started collecting SSDI in January 2022. Why would SSA send me a BK 820 form wanting information, money I earned in 2019-20? They should have checked that before I got approved, right? If you started collecting in 2022, yeah, you figure, yeah, yes, your logic is correct. They should have definitely checked that, but for whatever reason, they want that information again. Maybe if it's just straight wages, maybe you were going over a little bit, and they want to see if they can apply any UWAs or IRWs, which are unsuccessful work attempts or impairment related work expenses, or if it's, self-employment, whether, there's a lot of different variables. Yeah, it seems as though they should have checked all that before, but again, the Social Security doesn't get detailed earnings from the IRS until after you file, and sometimes the computer system is based on Fortran and COBOL, programming language from the 1970s. So it's not very smart. So maybe somewhere somehow it didn't pick it up. But number one thing is return it. Fill out the paperwork, return it, make a copy of it before you return it, take it down. If you want to take it down, hand it over to the person, they can make a copy. Have them stamp and initial your copy, and that way you've got it that you actually returned it. Yeah, the whole thing about doing certified mail, that doesn't really, it shows that it got there. It shows that the IRS, or excuse me, it shows that the Postal Service delivered it, but it can still get lost. Usually documents aren't lost in a Social Security office. They're just put in somebody else's desk, and that person, doesn't go through their mail. And yeah, so it's kind of lost, misplaced for weeks. Yeah, sometimes it's crazy. It's crazy. Let's see here. I will be applying for Social Security. My deceased ex-husband was married 20 years. I remarried at 49. Can I claim some of his? No, it sounds like no, because you're currently married. So you won't be able to collect any benefits from a previous spouse because you are currently married. All right, Pete, if the child was approved for SSI as a small child and it was discontinued due to a parent income increase, now the child is early 20s, do I have to prove the child still has the disability? Yes. So what happened is the child was receiving SSI, supplemental security income. That's, kind of a welfare-based benefit, needs-based benefit, and then parent income kicked them out of that. They were still determined to be disabled, but not receiving the welfare benefit because too much money was coming into the house. So even if the benefits were continued, Social Security has a different process and different qualifications for an adult disability versus a child disability. So pretty much everybody has to go and kind of go through the whole rigmarole again once they turn 18. So if you have a child that's 10 years old, 15 years old, receiving disability benefits, as a child disability benefits, once they become a DAC, from CDB to a DAC, disabled adult child, yeah, it has to go through the whole thing again once they turn 18 years old. So yes, unfortunately, I have to go through the whole thing again. Okay, Zippy, here's the other part of the question. Added question: what would happen if I earned over SGA 1 or 2 months? Yeah, that's kind of what will happen is you won't get benefits for 1 or 2 months. If you go over the benefit amount for the year, and if you go, so if you go over, let's say $1,000, it's not on the month. We're not doing the monthly thing. You're talking about the whole year. You can only do the monthly thing on the first year. So if we're talking about the whole year, if you go over $1,000 over, let's say, then Social Security will hold back $1 for every $2 you go over. So you owe $500. But if you call up and say, hey, I'm going to go over, so hold my check. They can't hold a partial check. If you get $1,000, they're not going to hold back, just $500 and give you that 500. They're going to hold back the whole check. So you can notify them and they can hold back. Or if you're just going to go a little bit over like that, what some people do, I'm not making a recommendation, I'm just telling you what some people do, is they just go ahead and just forget about it, let it ride. When they do their taxes the following year, they do their taxes, they send it to the IRS sends it to Social Security looks at it and says, hey, what's your name? Zippy made $1,000 too much last year over the annual earnings limit. He owes us $500. So they send you a nice little nasty gram that says, you owe us $500, pay us now. And so that's how it works. Pretty much nobody pays it right out. You can set up a payment plan, or you can pay it right out if you want to. So good time. Thank you. Keep up the great work. Thank you. I appreciate it. Yeah, everybody, please press like. When you press like and subscribe and all that kind of stuff, this information goes out to all kinds of people that need it. I think need it. So you're paying it forward by doing that. So do your charitable work today. Press that button twice, or 3 times, or 4 times, whatever it allows you to do. Pete, SSI was approved due to disability. Now applying based on my SSI. Was approved due to this. Now I'm playing. Okay. Trying to figure out what that. So if you file for disability, there's 2 programs. There's SSI, the welfare-based program, supplemental security income, and then there's SSDI, what you actually paid FICA taxes, Social Security Disability Insurance. And it sounds like Pete didn't pay into Social Security enough or recently. So he's qualified for SSI. So it sounds like his disability was approved. And now what you have to do is what we call it internally as a perk, is basically, okay, your disability is approved. Now we just want to make sure that since you applied for disability, 3, 4, 5, 6 months ago, nothing has changed. So then they call you up or whatever and go through all the income and resources. And if you say, oh, okay, well, yeah, since I applied for disability, yeah, you approved me for disability, but I just won the lottery yesterday and now I'm a billionaire. So they're going to say, oh, congratulations, you're still disabled, but we're giving you 0 money because now you're a billionaire. And you can buy Ed a coffee by pressing the thanks below there. Pappy, I'm about to receive my first Social Security check. I still work and I have medical insurance. I also have an HSA account. Did you say I can no longer contribute? That is not good, as I really want to for the rest next. Yeah. The HSA. I just ran into this. It's Social Security employees, and the system is just terrible about all that, because Social Security employees are not trained on, HSAs or the Medicare Part C, which is the Medicare Advantage plan, or the prescription drug plan Part D, or Medicare supplements, because all of those are private things. And Social Security employees are government, so they don't tell you whether you should get a lawyer or not, or what lawyer to get, or whether to get this Medicare Advantage or this Medicare supplement plan, or give you financial advice on HSAs and stuff like that. They're government employees. They don't want to, the government doesn't want them to give out that private information, so they don't, and therefore they don't get trained. So everybody makes a lot of mistakes on this, and the computer system internally, I have found very recently, is not. So anyway, super long story short, all right, if you have an HSA, then you can no longer contribute to an HSA once you sign up for Part A. Okay, and in order to get monthly benefits, you have to sign up for Part A if you're 65 years old. If you're 62, then you don't have to. But if you're 65 years old and you want your benefits, you have to sign up for Part A. If you don't sign up for Part A, you don't get your money. In order to get retirement benefits, you have to have Part A. You have to have Part A. You don't have to have Part B. Part B, you can, if you have insurance from work, you can decline Part B, right? And so most people just go ahead, 99.9% of people say, okay, hey, Part A is free. I'll go ahead and sign up for it. I don't care. I don't want B. But in your case, the very, very, very small percentage of people who have HSAs, they can't have an HSA in Part A because they can no longer contribute to the HSA. And I've had a few people contact me and say, hey, Social Security employee didn't tell me about that whole HSA thing, and I got Part A, and I continued to contribute to an HSA, and the IRS sent me a nasty gram saying I owe all this money back. So in order, if you're not if you're 65 and you have an HSA, you have to stop You have to stop contributing to the HSA, and you have to do it 6 months before your Part A starts, because Part A is gives you 6 months of retroactive. So yeah, it's crazy involved with HSA, and Social Security employees pretty much know none of that. The computer system doesn't really identify that issue. It just says, "Hey, do you want Medicare? Yes or no?" No, I don't want Medicare. Okay, and you think you don't get Medicare across the board, but it's just B. So yeah, the whole system that is just super. I think that and the widow's calculation is probably the most difficult thing to understand in all Social Security. Yeah, yeah. Steve, doctor, my wife passed 2 years ago. Oh, sorry to hear that. And was on Social Security disability. I intend to claim widow's benefits at 60. I understand that I will get only 71.5% of her amount, but will there be COLA? Yeah, yeah, everybody gets COLA. Yep. So yeah, it sounds like you are doing the right thing as well. Well, you're 60, so that's the only thing you can do is collect survivor benefits. And then once you turn 62, then again, the strategy is, if you want to go ahead and switch onto your own record, if it's more, but I would pause and think about it. Even if your benefit on your own record is $100 or $200 or $300 more, 300, I don't know. Possibly stay on survivors and let your benefit amount get even more. Again, if you need the money, you need the money, and then start it. But yeah, call up Social Security at 62 and say, "Hey, how much is my benefit if I start now?" And they'll tell you and say, "Oh, it's $100 more." Okay, how much is it going to be in a year to you? And they'll tell you, whatever, and then make the decision based on that. So, mm, Zippy, do you take personal questions about SSDI for a fee? If so, how do I contact you? I don't know your email. Yeah, email is the little ticker thing down there. Yeah, I just started last month. I because providing all this free content and service and everything, the website. Oh my gosh, the website was just crazy expensive. And my wife said, "Stop using our retirement money for this stuff." So I've unfortunately had to start charging. So you get all your questions answered, and you support the channel. So yeah, in the description, it has my Calendly link that you can schedule an appointment. Unfortunately, yeah, I have to charge for that to get everything. But if you come here, all the questions, live Q&A. I've been doing a live Q&A every day for, I think I'm on day 30. So this is 100% free. So, and people on TikTok, unfortunately, TikTok hates me because I talk about bad stuff, death and money and stuff like that. And that's what you got to talk about when you're talking about Social Security and Medicare and retirement, all that kind of stuff. So, um, for all the TikTokers out there, come please join us on YouTube. Catherine, what is a widow's pension and would I be able to get that on Social Security disability? I'm 60 and my husband was almost 65 before he passed on July 11th. He never got to retire. Wow. That's hate to hear that. Yeah, widow's pension, definitely. If you are receiving disability, you might be able to get more money from your deceased husband. So you're 60, so that means you can start. This is it. Everybody that pressed like and subscribes up until now, this is why Catherine got to this channel, and she might be missing some money here. And as I always say, I could be sitting here all day doing these things and nobody's watching. But when you press subscribe and like and share and all that kind of stuff, people like Catherine find this, and we might be able to find her some money today. Okay, Catherine, here's what you do. So you're receiving disability benefits and everything. I would call Social Security and say, "Hey, I'm 60 years old. My husband, paid into Social Security and everything like that. Can I get any surviving spouse benefits?" And they will run the numbers. And what I would do is I wouldn't people get a lot of incorrect information when they call the 800 number or they call the local office or they go to the local office and just talk to the frontline personnel, which are the hardest working people in Social Security, the least paid, but they have to know a little bit about everything, but they're not specialists in this. So I would schedule an appointment So you can actually talk to a claim specialist, a Title II claim specialist that does this. Rather, you don't want to talk to the frontline personnel. You want to talk to a specialist, and then say, "Hey, I'm receiving disability benefits. It's X amount. How much would I receive if I received surviving spouse benefits?" And they'll tell you the numbers, and hopefully it's a whole heck of a lot more. They'll make your life easier. But then ask them about Medicare. Usually, how it goes, you'll probably you, they'll probably put you as a dual entitlement. So you'll be getting your SSDI on your own record, and then you'll get the difference between what you're receiving on your record and the survivor benefits. So you'll still be entitled to Medicare based on your own record. So that'll continue. So make sure you ask about Medicare in your particular situation if you are receiving Medicare. But yes, Catherine, please. It's 3 o'clock. Call Social Security, run to the phone, call 800-772-1213 and set up an appointment. Your appointment won't be for a month or so, probably. Or you can even ask the person on the phone, give them your husband's information, and they would probably be able to look on there to see if there's any more money. If your husband worked a whole heck of a lot more than you did, then yeah, there'll be money there. So yes, yes, and also be advised, is who was the other person who was asked, if you take the surviving spouse benefits at 60, then it's going to be a full reduction. So it's going to be reduced to 71.5%. So ask them at that time. Just because you have an appointment, just because they're starting the claims process, doesn't mean you have to go through with it. So have them run the numbers, start doing the claim, yada, yada, yada. And once they tell you the final numbers, then sit there or say, okay, well, let me think about it. I'll call you back. You're not inconveniencing the Social Security employee. That's their job. And if it's, and say, okay, what if I wait a year? What if I wait 2 years? What if I wait 3 years to collect those widow's benefits? And then you can make your informed decision. So yeah, Catherine, once that happens, yeah, call us, or come on back and let us know. See if all the people that pressed like and subscribe found you some money. So thank you to the people that like and subscribe. And so Catherine was able to find us. All right, Sharon, looking for the right prescription plan for retirement. I know you have contacts. Can you offer any help in choosing or direct me to someone who can please help? Yeah. So it's if you're just looking for a prescription drug plan, so that's probably means that you have a Medicare supplement plan only, a G or an N. And so I would wait until October when the new plans, if you've already got a prescription drug plan, you probably can't change it anyway right now. But wait until the new plans come out in October, and then you can see, I think on my little ticker down there, it's got my phone number or my email. Just email me and say, hey, Ed, your name, your phone number, your state, because all states are different, and then tell me what you need. Hey, I need help finding a prescription drug plan in October. I want to review my Medicare Advantage plan in October. I want to maybe see if I can save some money and switch my Medicare supplement from a G to an N. I even got people that help with burial insurance, because I know from experience helping hundreds of thousands of people out. The $255 lump sum death payment that Social Security gives you doesn't cover a funeral. So yeah, you really need to get something in there. So I was tired of these insurance agents and Medicare insurance agents not doing the right thing. So I decided to put a team together. And if they don't treat you right, let me know, and they will no longer be part of my team. All right. Let's see here. Wow, Sue's got a long one here. So Sue, my husband started collecting at 62. My disabled adult son collected off of his record. Okay. I applied for child and care benefits on spouse record in January 2024. Just got letters that my son's check has been cut in half and I will receive the same amount. Okay. So that is the family max. So on your husband's record, there is a maximum amount that can be paid out. So that what, 75% of your husband's primary insurance amount was being paid out to your son. Um, and then you went ahead and filed for child and care benefits because the child is under 16 or became disabled before the age of 22. So yeah, child and care benefits. People can get child and care benefits, but there is that family max. So it was cut in half. So that means the total amount. So if it was $1,000, he was getting $1,000. Now he's getting 500. You're getting 500. So it doesn't really, you know, make sense to do the child and care benefits. Um, yeah, if um, yeah. So and you've only got one child, I assume, on there. So yeah, so you can tell them that no, I don't see any reason to continue child and care benefits if you've only got one child and that month, the money was just taken from him. So I would, it's your choice, but yeah, I would just go ahead and forget about it. Tell them to take you off child and care. But make sure they check and oops, make sure they check and confirm that the family max is correct. So, and see if there's any more money in there at all. All right, Pete, child's SSI was approved based on disability. Okay, all right, partial question there. Peppy, I'm about to receive my first. Okay, I think I already answered that. Catherine, Social Security is supposed to call me on the 21st. Okay, all right, Catherine, good deals. Yeah, definitely checking that survivor benefits. And yeah, again, you don't, they're not going to pressure you. These not used car salesmen where it's, if you say, okay, let me think about it, they're like, oh my gosh, I lost the sale. No, they love it. That means they have, an extra 5 minutes in their day, to get to their next, 15, claims that day. So, yeah, tell them, okay, all right, how much this year? If I start this month, how much if I start next year? Yada, yada, yada. How much is going to go up? And then, you don't have to make your decision at that time. Says, okay, let me think about it for a day and I'll call you back. So, and make sure you ask about Medicare. Carletta, I see zeros on my earnings. I started working in my teens, which make my earnings and over 40 credits. The system has not updated my FRA. All right. So, yeah. So, Social Security determines your earnings by your high 35 years of earnings. So, if you've got zeros there, then just my if you've got zeros there, then yeah, if incorrect zeros, then you need to get those corrected. Because again, if you've got 10 years of earnings and 25 years of zeros, you just do the math and it brings that down quite a bit. So if those zeros actually shouldn't be there, then you need to provide some type of proof to Social Security that you worked. And there is what's called the suspense file. So if you work for a place in 1982 and the same place in 1983 and 1984, and 82 is good, 84 is good, but 83 there's a zero, there's that gap there. And what you can do is, that's easy to fix. Call up Social Security and you say, hey, 83 is zero. I worked for the same place before, the year before, the year after. And what they'll do is they'll look in the suspense file. They'll look at 82 and they'll find the employer identification number. And they'll look and see if that year, if there's any money in the suspense file. It's basically usually what happens if they mistype a Social Security number, 1-2 should be 2-1. And, so those earnings are just sitting out there. And it's super, super easy. I've done this hundreds of thousands of times when I worked at Social Security. And they just take the money out of the suspense file, slap it on your record, recalculate the benefit amount, and you're good. Yep. So, and in terms of not updating the FRA, yeah. So your FRA is 2024. Yeah. So I would definitely check out that. Make sure your earnings are correct. That's the most important thing when filing for Social Security is making sure, yeah, making sure that you're getting what you're entitled to. Liberty, I like to where I was researching the state of Tennessee. They have not expanded Medicare. What does that mean? Probably Medicaid. Yeah, not expanded Medicaid. So there's some states that decided to go against, the Affordable Care Act, Obamacare, and expand Medicaid for particular populations within your state. A lot of states have. Yeah, I think a majority of the states have, but yeah, like Tennessee, I think Texas and some other states have decided not to do that for whatever reason. So yeah, it's so a lot of people are caught. If you got a lot of money, then it's not an issue. And if you got, yeah, so it's time for you to reach out to your Tennessee representatives and tell them that they need to expand Medicaid. Puppy, I think Social Security people put me on Medicare, yet I want to keep contributing to my HSA for another year and a half. Can I call them and tell them to take me off Medicare? If you are receiving Social Security benefits, then you have to pay all that money back. Because Part A, you can refuse Part B. People refuse Part B every single day. But Part A, you have to have. If you want to continue submitting your contributing to your HSA, then yeah, you need to get rid of Part A. But then you have to give all the money back that you've been receiving from Social Security. So yeah. And again, Social Security employees won't tell you that because they don't know that, and the computer system doesn't help. So anyway, Shannon, hello. I just switched Medicare plans the 1st of April. I had Medicaid paying for my Medicare Part B out of my Social Security check, but I also had a prescription included. Okay, all right. So, okay, yeah. So this is another issue. During the pandemic, people that are on Medicaid get a regular recertification every year or so, depending on the state. So they, contact you and say, "Hey, did you win that $1 billion lottery?" And nope, didn't win. I still have X amount of money and resources. And they go, okay, we'll continue your Medicaid. But during the pandemic, the federal government says there's a little pandemic happening here, so don't kick anybody off Medicaid. And that happened for what, 2 or 3 years, and then just last year they said, okay, you can go ahead and start doing these recertifications, and people are getting kicked off Medicaid throughout the country. And John Oliver just did a really good story on this the last week tonight on HBO, but you can watch it on YouTube. He did a really good story on this, but that's fine. Getting people that are not entitled to the Medicaid off of it, but the problem is a lot of people are still entitled to Medicaid, but they're being kicked off incorrectly. So if you know 100% that, okay, I'm making a lot more money than I did before, and I know I'm not going to get Medicaid, then okay, that's fine. But if you say, yeah, this is strange, I should get Medicaid, then I would definitely, ask for them to take a look again. But once you lose your Medicaid um, so Shannon already had Medicare as well, probably. So you can have Medicaid and Medicare. So people that have Medicaid and Medicare are dual eligible. They're dual programs. And they're eligible for a Medicare Advantage plan, a dual eligible plan for those people with Medicare and Medicaid. And those dual eligible plans, yeah, they have they have the stuff that everybody wants, the grocery cards and the flex cards and the zero this and the zero that and all that kind of stuff. But it sounds like Shannon was kicked off of that, and therefore she lost her dual eligible plan and she looked for another Medicare plan. If you signed up for a Medicare supplement plan, then yeah, a G or an N, then yeah, you need a Medicare prescription drug plan. But if you signed up for a Medicare Advantage plan, another Medicare Advantage plan, a non-dual Medicare Advantage plan, most of those have prescription drugs program, that the Part D bundled in there. So if you have a Medicare Advantage, there's 90% chance you have a prescription drug plan. But if you got a Plan G or Plan N, then yeah, you need to get a prescription drug plan. And if you watch any of my videos, I always recommend, if you have the money, if you can afford a Medicare supplement plan, Plan G or Plan N is the way to go. But all the other insurance agents in the country will tell you Medicare Advantage is the way to go because they make more money. Yeah. You make less money on a Medicare supplement, even though there's a premium. Medicare Advantage, most of them are zero premium, but the companies and the insurance companies and the agents make more money. It's ludicrous. Yeah. So anyway, all right. So now my new plan said I have to pay for prescriptions as of 20. Yeah, yeah. So that's because you probably don't have the dual plan anymore that covered a lot of that. So, um, Pete, I made a mistake. I'm receiving Social Security, not SSI. I heard if the child was disabled prior to age 22, the child becomes eligible based on the parent's Social Security. Why is it necessary to prove the child's disability again? Yeah, so again, it's the same type of thing. Everybody, we used to have a person who was at Irma, yeah, in our office. Used to do those. No, it's Chris. Okay, um, trying to think of all my employees I've had. They've since retired. But yeah, you have to. They have to do it again. They have to change it from a childhood disability, which has different parameters, versus an adult. So it's just part of the bureaucracy. Carletta, great information. Thanks. Yeah, you're welcome. Welcome. Thank you. Thank you. Donna, I am a full-time worker and will be 65 in October. My husband passed in 2016 and he would be turning 66 in October. Can I take his and still work? And when is the best time to make an appointment with us, with Social Security? Yeah, it's so you can still work, but you have to stay under the annual earnings limit, even if you're receiving benefits as a survivor or spouse or whatever. And that's the $22,320. If you go over that, Social Security is going to hold back $1 for every $2 you go over. So yes, if you are going to go ahead and collect survivor benefits and then don't touch yours and let yours increase, that is a very, very good strategy. A lot of people do. You have to, check the numbers. If your benefit amount is never going to be higher, then, stay on survivor benefits immediately. But if your benefit amount is just immediately way, way, way higher, then, that might be a thing to, if you need the money, go ahead and start on your own. In terms of when is the soonest, then, 1 or 2 or 3 months before. Those are pretty easy applications, done hundreds of thousands of them, take 20 or 30 minutes. And don't go out there, and spend all this time and money getting, documents, marriage certificate and divorce decree and stuff like that. Don't wait. Schedule an appointment and then start working, getting on those documents. And if you can't get them, then by your appointment time, then no problem. Keep your appointment. And then 65, if you're working, then you don't have to sign up for, Medicare Part B. You don't have to pay the $174.70. Once you stop work, that is if you have health insurance from work. If you have health insurance from current work and your employer has 20 or more employees, you don't have to sign up for Medicare. You can just sign up for the monthly benefits, and then once you stop working, then you get your Medicare at that time. Let's see. Can I take widow's benefits as a 6-month back pay, then at 62, file under my own Social Security because it's $400 more? Wow, it's a lot of and do yeah, yeah, and it's not, yeah, I'm not gonna do the Palms reference here. Okay, I'll answer part of this. Yeah, back pay, whether you get back pay or retroactive pay, there's a lot of too many variables in there. So yeah, don't have that GN reference memorized right now during a live. Sorry for the multiple messages. So if I stop my Social Security payments, then can I continue my SSA deductions? Yes. Shannon, I am also now having to pay for my Medicare Part B out of my Social Security check. So what options do I have? Yeah, same type of thing. Yeah, the Medicaid, it was part of the Medicare Savings Program where it paid for your Part B premium. So if you lost Medicaid, now you have to pay for it yourself. So yeah, there are plans out there, Medicare Advantage plans, that have the government allow them to do this thing called the Part B give back, where it pays the insurance company you sign up with pays part of your Part B premium, and it depends on what if it's available in your area, and they pay $50 of it, 75, 100, whatever, the whole thing, whatever it is in your particular area. But those you really need to look at, because an insurance company, these insurance companies don't get to be billion-dollar insurance companies because they're stupid. If they're going to give you essentially free money, they're going to pay for your Part B premium, they're going to take it out of someplace else. And it's usually, deep in the details. Okay, if you ever go to the hospital, you're going to have to pay this much more than everybody else. If you get an MRI, you have to pay this much. They're going to get their money back. So yeah, be very careful getting those. There's some of them that are good. People at the VA and stuff like that. Those are very good plans. That's why a lot of them are called Patriot plans or Honor plans. But yeah, that is one option. So yeah, give me a call, email me, and I can have one of my. I've got to put together a network of nationwide Medicare insurance agents that you can trust, that tell you the right thing, and they can check out all your options. And if you just lost Medicaid, then you have a special enrollment period that you can change your plan. But if you don't have a special enrollment period, you have to wait till October. So you can email us and say, hey, Ed, here's what I got. Here's my name. Here's my phone number. Call me on October when the new plans come out. And we can definitely do that. Jason, hello. Any tips on my first time seeing the doctor for the first time? I'm in the beginning stages. Lawyer says we will shoot for SSDI and SSI. Any tips? Yeah, I did a video. I did like 3 or 4 videos on disability a few weeks ago. So make sure you check out those 3 or 4 videos, and it gives you some tips, tricks, and secrets on, kind of insider tips, tricks, and secrets of how to get your claim approved. Keep notes. It sounds like you're going to a consultative exam or something, the Social Security doctor. So yeah, watch those. I think they're about 10 or 15 minutes each. So definitely check those out. Tanya asking for a friend, what do you do before 65 if you're still working and have medical as far as signing up for Medicare? Yeah, so if you're 65, if you're going to be turning 65 and you have health insurance from work, your work or your spouse's work, and your employer has 20 or more employees, then you don't have to sign up for Medicare. Yep, don't waste the $174.70. Once you stop working, stop receiving health insurance from work, then at that time you have 8 months to sign up, and there's no penalty whatsoever. Technically, you have 8 months, but yeah, you know what happens when you don't have health insurance for 8 months, right? That's when you actually fall or get sick or something. So about a month or 2 before you're going to stop your health insurance from current work, then sign up for Medicare. And there's a couple of forms you have to fill out. And so come on back here in that time, and we'll go through the whole thing, and make sure you subscribe and all that to keep updated on any changes. Follow-up question regarding widow's benefits. Is eligible starting amount to be claimed equivalent to the amount she was claiming at time of death, or will COLA be added between time of death and claim? Yeah, so again, survivor benefits is a nightmare in terms of calculation. So if they were receiving benefits at the earliest, there's a different calculation. There's a widow's cap. Everybody receives COLA. So that COLA is calculated as soon as Congress says, hey, increase everybody's benefit amount. So they don't say increase retirement benefit amount, or increase disability, increase, divorce spouse, or no, increase spouse benefits, but not divorce spouse or somebody. They don't say that. They just say increase benefits by X amount. So people always ask, is COLA this or COLA that? Congress says increase benefits, and all benefits are increased. So Carol, my FRA is November. Can I receive the maximum eligible amount from my ex-husband now, or have to wait until November? Have to wait until, again, is like ex-husband. His FRA was last November. Ex-spousal rules all apply. Okay, so he is alive. So no, you have to wait until your full retirement age to collect the full benefit amount, down to the penny. Oh, Alex Takahashi became a member. Thank you very much, Mr. Takahashi. I was going to say in Japanese. I speak Japanese. Takashi-san, arigatou gozaimasu. Yoroshiku onegaishimasu. All right, that'll be it. Yeah, but I would definitely check it out. If you definitely want every single penny your full retirement age, then go for it. But a couple, 3-4 months early, you get all those checks. If it's $1,000 4 months early, that's $4,000. Sure, it's going to reduce your benefit by, $15 for the rest of your life, but you get $4,000 now. You might be able to pay down some debt or something like that. So, yeah, maybe kick that around. But in terms of get the full benefit amount, it has to be your full retirement age. Sharon, no current plan, just retired in Kentucky and have Medicare A and B. Yeah, you need to. Yeah, so you're, as they say, you're running naked. Part A and Part B is awesome. I always recommend keeping original Medicare. That's why I recommend Medicare supplements. But if that just isn't in your budget, then it's not in your budget. But if you just have Part A and Part B, you're exposed to a lot of financial risk. The biggest one is the Part B premium, or excuse me, the Part B co-insurance, which is 20%. So if you have a $100,000 bill from the doctor, you have to pay $20,000 out of your pocket. Yeah. So lovely. Hello to all. All right. Hey. Carol, at 65, I started receiving widow's benefits at $1,200 a month. 6 months later, I stopped working due to health issues. I am now 67. Okay. All right. Douglas, work for a large corporation, good medical benefits, 65 next year, want to delay Medicare A and B until no longer working. Keep HSA going past 65. Yeah. Yep. So then you won't be able to collect benefits unless you get A. But if you're giving to an HSA, then so there's that. Again, 6 months before, you have to stop your HSA 6 months before, because again, this is not Social Security. That's one of the problems why Social Security won't really tell you all this kind of stuff, is because it's not really a Social Security issue. It's kind of an IRS issue. So Maria, if I retire at age 60, will I still pay taxes for my Social Security benefits? Yeah, I don't do taxes, but because there's way too many variables. It depends on what other income you have. The state, you might pay state taxes, but everybody can pay taxes on their Social Security up to 85% of what you're receiving in Social Security. Not 85% tax rate. It's up to 85% is fair game for taxation. Again, depending on a lot of variables, all your other income and everything. So, and I receive right now a state of Florida retirement. I want to pull my ex-spouse's Social Security. He is deceased. I will be 65 in September. Will they consider it as income? It is more than what they will allow. No. Yeah, a pension or anything like that is unearned income. So yeah, that will not count as earnings or anything like that. It's only actually, working, going into work, punching the clock and stuff like that. Any money from like a 401k or a state pension or, anything like that is not considered earned income. So nope, it's not considered part of your earnings. Douglas, at 67 or 68, start receiving survivors, but might still be working and want to keep the HSS go. Okay, more HSA. HSA is such a nightmare. Roxanne, what can I do when I have Medicare and Medicaid with QMB because I'm disabled? Then my husband passed away and he was a veteran and they started giving me my widow's benefits, lost my benefits, help. Yeah, that's I've seen this way too many times where people have Medicaid and QMB is qualified Medicare beneficiary, which is the highest level of Medicaid you can get. So they were paying her Part B premium and all that kind of stuff. And then, something happens, you turn 62 or your spouse passes away or something, and they give you some more money. You're like, oh, great, more money, which is great. But it's like puts you like $1 over. And Medicaid said, you're $1 over, so you don't get Medicaid anymore. So you get $1 more, but you lose hundreds of dollars worth of health care benefits money savings. Yeah, that's unfortunate. But yeah, if you're losing Medicaid, then you're also losing your Medicare Advantage dual plan, which had, as all the extras in there, and you're going to have to pay your Part B premium. So yeah, you need someone to is I hate that you need to find the best of the worst alternatives. I mean, old Marine Corps sergeant here, so I have to tell you the reality. You're not going to get anything as good as you had it before with a Medicaid and a QMB and your Part B being paid and the Medicare Advantage dual plan with all the extra benefits. Yeah, unfortunately, you've kind of lost all that. But so you need to get the best of what's available. And if you have a Medicare insurance agent, reach out to them. If you don't have somebody you trust, give me a call, leave your name, phone number at your state and tell me what you need, or email me and we'll have someone reach out to you and give you all your options. That's 100% free, and no obligation. If you don't like it, then it is what it is. Carol, why would my payment date for Social Security, the first Wednesday payment date, be switched to the first of the month, SSI dates, with the state extra help for Part B? Yeah, it's bureaucratic stuff. Normally, most checks, retirement checks and stuff, it's based on the day of the month you were born. So if you were born the first 10 days, you get your check on the second Wednesday of the month. If you're born in the second 10 days, you get on a third Wednesday of the month. The people that have been receiving benefits for a long time, get it the first of the month, SSI the first. And yeah, so it's bureaucratic. And I have found, yeah, we used to be able to change the pay date. It was always very, very, very difficult. But yeah, now I've heard that they just don't change the pay date at all anymore. So, born 1958, turned full retirement age November 2024. How much money can I make a month starting July 1st each month and for the rest of the year and not get penalized? Okay, so full retirement age November 2024. Um, uh, yeah, you can make this year. You can make 59,000. $59,520 from January till October. So if you're over that, then they hold $1 for every $3 you go over. But if you're going to be under $59,000 for the first 10 months, then you don't have to worry about any of that because this is your full retirement age year. So there's that. No one told me that I would lose my Medicaid and QMB. Yeah. Yeah, I'm not sure. Was this part of a previous? Yeah. 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 Did I misread that? Let's see. What can I do when I have Medicare and Medicaid because then my husband passed away? Yeah. So okay. So hopefully, okay. So Roxanne, so this might not apply to you. So your survivor benefits, so if they haven't told you, then maybe your survivor benefits don't put you over the allowable limit. But hopefully that's the fact where you can collect survivor benefits and you can still get your Medicaid and all that rest of stuff. But yeah, and I'm just like, I hope you get a lot more money, but it's like, okay, if you get $200 or $300 extra a month, then you lose your Medicaid, and so yeah, it's that kind of in between part is tough. So hopefully, yeah, if Social Security just recently told you that you're going to get survivor benefits, and they told you how much it is, I would probably reach out to Medicaid because they'll find out. The computer system, Social Security system, talks to the state Medicaid offices. I work for the state Medicaid office, and they talk to each other, but it takes forever. And you might be going along, and then you go to the doctor one day, and you show them your card, and they'll say, "Yeah, this has been canceled. You no longer have this." So I would reach out to Medicaid and say, "Hey, Social Security just told me I was eligible for survivor benefits, and here's how much I'm getting." And hopefully they will say, Oh, okay, that's good. That's fine. You're still within allowable limits, so everything will be the same, and you get an extra $100 or $200 or whatever the case may be. So hopefully that's what happens. Does the money a child gets as a minor to a retired parent need to be used immediately? If you save it for 3 or 4 months yeah, this is a question about. I get this all the time. Um, when children are receiving benefits from their parents, and Social Security sends out all these weird letters and to to confirm that the money is going for the children's welfare and stuff like that. And the reason all that started is there was a lady in California several decades ago that put that had a little boarding house for destitute people. I think it was like many decades ago. And yeah, then she would bring them in and kill them and bury them out in the backyard and keep their checks. And she was the representative payee for all these people. So when you're the representative payee, one person burying people in the backyard ruined it for everybody. Go figure. So since that time, Congress said, okay, you need to be a little bit more preemptive in checking to make sure these benefits are going for the welfare of who they're intended to. So if you have a representative payee, someone that can't take care of their own benefits, send a letter to that representative payee every year, a payee report to say, hey, what did you do with that money? And if it's a natural parent, you just put, you know, the kid has a roof over their head and food in their belly and a, PlayStation or not. Yeah, then nobody cares. But if it's like a foster care situation, and those are looked at a little bit more intensely. But if you're the natural parent, you can do whatever you want with it. Put it in the bank, use it to pay rent. If you're paranoid about it, I talked to somebody last week about this. They were kind of paranoid. Well, I get this much money from my pension, from another pension, and I get this money for my child. I'll tell you what, I'll use the money from my child to pay the rent and buy food. And this money I'll put to his future education 10, 20 years from now. But the only difference, is in the person's head that says, oh, I'm using it because it's all going into the same bank account. So, yeah, super long story short, don't worry about it. Can't I decline Medicare Part A and still receive survivor benefits at FRA, still having qualified medical from work? Yeah, so it's Part A is essentially mandatory. You can, because it's free. The only time it becomes an issue is an HSA type thing, but Medicare Part B is the one that costs you money, and you can decline that. Yeah, and save yourself the $174. Tanya, I was kicked off Medicaid, but waiting to get approved for SSDI. I don't make to get Obamacare, so now I am uninsured. So don't make. Yeah, so you weren't able to get Obamacare. Yeah, that's so people that are retiring early as well, if they retire at 62 and and actually retire, stop working and stop receiving that health insurance, then they have to sit around uninsured for until they're 65. So that's why I recommend getting Obamacare, Affordable Care Act, whatever you want to call it. That's all right, Maria. I have Medicare Part A, no Part B because I have Kaiser from my husband. Am I to call Medicare every year to activate my coverage? Nope, nope. You're good. Yeah, no, you're good. So once your husband stops working and stops receiving health insurance from work, then you can sign up for Part B, and there's no penalties whatsoever. Yeah, every time I talk about the HSA thing and the A's and mandatory, all that kind of stuff, it confuses everybody. That's why, yeah, the HSAs are things just yeah, crazy. Let's see. Yeah, we're at the an hour and 10 minutes. Let me get to someone that hasn't asked a question here, because we'll do one or two more questions. Okay, let's see here. Kitty hasn't asked a question. I haven't answered her question. For the Commonwealth of Virginia, I like how they do that. Commonwealth of Virginia, not just Virginia, Commonwealth of Virginia. I like it. What is the limit of income to qualify for Medicaid and for the Commonwealth to pay for our Medicare? Yeah, that each state is a little bit different, but it's usually X percent of the poverty level. Um, so I would just reach out to them, and because you know, I, you can go onto the Commonwealth of Virginia website and it'll tell you exactly. But as with all government bureaucracies, there's exceptions to exceptions, exceptions. And if you see something that says, okay, we can only make X amount of money, and then you say, okay, well, we make more than that, and you just forget about it and you don't apply. And then 6 months later, you learn that, oh, they don't count that. They don't count this other thing. So we could have been receiving Medicaid for the past 6 months. And so, yeah, that's their job. The employees in the state Medicaid and Social Security, that's their job. They, call them up, take the claim. They will determine what's countable income and resources and all the rest of that stuff. And then, yeah, you get what you're entitled to. All right, Antonio. Just received SSDI a few months ago. My ex passed, married 12 years. Do SSA switch me to survivors, or I have to apply? Yeah, you have to apply. So yeah, call up Social Security and see if there's any money there. And again, kick around your options. If you start your survivor benefits this much, how much it is. If you start next year, how much it is, and all that kind of good stuff. All right, we'll do two more people that haven't answered any questions for them. If someone's monthly Social Security is low and his or her spouse income is high, can this person file taxes separately? Yeah, don't do taxes in order to get Medicaid to help this person pay Medicaid. Yeah, sorry, don't do taxes. All right. Love Lucy. Did I answer? Okay, we'll do. I'm receiving survivor benefits. My husband died September. I'm in YouTube posting videos, earning $100 only a year. Will I be penalized by Social Security? No, no. If that's a no, if nope, you're good. Um, Again, you can make up to $22,320. And if you're posting YouTube videos, and then you've got all the other expenses, internet and cameras and programs and all those other kind of stuff. So yeah, so with a self-employment, you can deduct, all the rest of it. All right, so let me do one or two little TikToks here. Sorry, TikTok. Please come over to my YouTube page, subscribe on my YouTube, and I can answer your questions better there. TikTok is not good for this type of thing. Where were you a manager when you worked? I ran the third busiest Social Security office in the country, which just happens to be in Las Vegas, and which is strange. I don't drink and really don't smoke, so, and don't gamble. I don't know what I'm doing in Vegas, but there it is. I'm under 62. My husband, who collects Social Security, passes. God forbid. Good. Do I receive the amount he had received? It really depends on a lot of variables. Yeah, survivor benefits. If he isn't receiving benefits and you're your full retirement age, you will receive 100% of what he would have received at his full retirement age. If he started collecting benefits early at 62, 63, it's different. If you start your benefits early, it's different as well. So a lot of different variables there. All righty, that is it. I think we did some good questions, and obviously we got some leftover. And I will be back tomorrow, and I'll do another topic tomorrow, and I'll do a bunch of more questions after that. So we'll see you then. And I apologize if I didn't get to your questions